Hi students, in this lecture we are going to discuss about the key points that needs to be addressed during a pre-implant counseling. It is a counseling that happens before an individual formally decides to go for an implantation program. It is important to provide pre-implant counseling as it gives an idea to the recipient as well as the family members what to expect during and after receiving an implant. It also helps them to set realistic expectations from an implantation program. It helps us to identify key factors that should be addressed during or after the surgery. The more the knowledge or information we provide to the recipient and family members, it will be easier for them in the decision making process. The family members might have a lot of questions in their mind regarding the current hearing status of an individual and what type of benefit they can expect from an implantation program. Hence, providing a pre-implant counseling will reduce the difficulty in making a lifetime decision. The key questions that needs to be addressed in any pre-implant counseling should include: how does an implant work? What are the type of evaluation that is required to determine the candidacy for an implant program? What are the general benefits and the risks involved in a surgery? What are the educational placements or the therapeutic needs of an individual with an implant? What are the long-term outcomes of an implantation program? What are the time and financial obligations from the parents or the family members? How does an cochlear implantee and the deaf culture coexist with each other? With respect to the first question on how an implant works, it will be better if we explain and make the individual as well as the family member understand how a normal functioning of ear happens, how it is going to help in our hearing. Then we need to explain the cause of hearing loss for this particular individual. Then how an implant is going to overcome this particular cause and improve the hearing. With respect to the type of evaluation required, depending on the stage at which we see a patient, we need to give information regarding the number of audiological tests included in an audiological test battery. We should also explain about other non-audiological tests which will be done by other team members or professionals involved in an implantation program. We should explain the duration required for each test procedure along with the waiting time in order to receive the test result. We should emphasize upon the need for multiple visits to an implantation center in order to undergo these test procedures. All these test procedures initially are directed towards the identification of the candidacy criteria and identify which type of implant will be best suiting a particular individual. Post-operatively also, a lot of test procedure will be carried out in order to check the benefit from the implantation program, how much of benefit an individual is getting from the implant. Risks involved in surgery has to focus upon the side effects of general anesthesia, such as lightheadedness, giddiness, nausea immediately after the surgery. We should also explain the possible damages that can occur to the anatomical structures during the surgery and its effects. For example, during surgery, if the facial nerve is damaged, then it will result in facial numbness or weakness after the surgery. In the same way, if the chorda tympani nerve is damaged, it will alter the taste perception in the individual who undergoes this surgery. We should also explain about the length of stay in the hospital during the surgical procedure and also about the overnight care and arrangements, immediate pre and post-operative requirements, the type of support available during this time from the hospital side, from the healthcare provider, and what are the support the healthcare provider expects from the family members during this particular crucial time. With respect to benefits from the implantation program, certainly there is going to be an improvement in the hearing, but these hearing outcomes are highly variable based on various factors, and these factors has to be explained in detail. We should also reassure the parent as well as the individual with hearing impairment that This improvement in hearing will gradually improve with respect to the duration of oral rehabilitation as well as the way in which they learn to listen through the implant. Regarding the educational and therapeutic needs of an individual with implant, it is going to be a tailor-made program. No two individuals will have same kind of oral rehabilitation program or educational placement. It depends upon the listening ability of the individual, the cognitive function, family support an individual gets, the communication environment where a particular individual listens to various sounds through implant. Hence, based on these factors, the therapeutic management is going to be tailor-made. It also depends upon whether we are going to focus only on oral communication or is it okay to have a multimodal communication setting and variety of educational placement. We should emphasize upon the importance of post-implant training, oral rehabilitation and appropriate educational placement in order to maximize the benefit the individual get from the implant. The long-term outcomes is not going to be common for all the individuals who are who undergo surgery for implantation. It also varies with various factors such as like the age at which implantation was done, the duration of hearing impairment, the type of implantable device chosen, how good the surgery was done with minimal damage to the anatomical structures, the duration of oral rehabilitation. So based on these factors, the outcomes can vary. We can quantify the long-term outcomes based on audition, how well the hearing is improving, what is the improvement in the speech and language skills of an individual, how well they are able to perform their scholastic performance. So based upon these three things, we can document the long-term outcomes, and these three factors is going to improve the quality of life of an individual with an implant. With respect to the time and financial obligations from the parents and family members, it is a key factor because they need to bring the patient or the individual with hearing impairment to the implantation center for undergoing various test procedures. They need to spare their time along with the individual with hearing impairment. There could be lot of appointments scheduled for assessment before implantation as well as post implantation. So pre-implantation, there is a requirement for detecting the candidacy criteria. So assessment procedures will be directed towards that particular point. They may be referred to an audiologist for hearing assessments. They may need to meet radiologists to get CT or MRI scan. They have to get psychologist opinion, ophthalmologist opinion and other professionals opinion. So each and every professional will fix an appointment and the patient might be available at that particular time. Also, after the surgery, they need to bring the individual with hearing impairment to turn on the device, then follow fine-tuning program for oral rehabilitation. If there is going to be any infection in the future, they need to meet an ENT surgeon in order to rectify it. So they should be available during those appointment time for those procedures. Regarding the expenses, we should explain the parents and the family members regarding various insurance schemes, Mediclaim insurance schemes, the government schemes under which the implant cost, the surgery cost, initial hospital stay are covered. We should also explain them about the various NGOs that are available for funding for an implantation program. We should make sure that there are no hidden costs or out-of-pocket expenses that might come as a surprise for the individuals with hearing impairment or their family members. We should also make sure that there might be recurring expenses in order to maintain the implant. With respect to how does the cochlear implantee and deaf culture coexist with each other, we need to explain them the different community of people with hearing issues. There is a group of individuals who are completely deaf, which means they do not have any residual hearing and they completely rely upon visual cues for communication. And hard of hearing population who have some amount of residual hearing and use amplification device. They have access to audition and rely on visual cues for adverse condition listening. and we have cochlear implantees who get most of the audition through their implant, and they also rely upon few visual cues for their communication. We should explain the similarities and differences between these community and how to approach them in different way. How the community is going to look at these particular groups, what is the social acceptance level in an environment, and what are the challenges these individuals are going to face with each other. These things has to be explained in detail. These are the important points which needs to be included in pre-implant counseling, which will facilitate the individual with hearing impairment or the family members to decide whether they are accepting to go for an implantation procedure or not. And these are the references used for this particular lecture. Thank you.